Okay, yes, this is the right one. So welcome to everybody and thank you for being here. So it's a pleasure to invite the first speaker of this session. We have as keynote speaker Claudia Pretner, who is a project advisor for the European Health and Digital Executive Agency. Thank you, Claudia, for being here. Hello, everyone. Welcome. So the human brain is a fascinating topic, a fascinating and also a crucial topic for health research. In fact, brain disorders are among the leading causes, the leading global health challenges. And maybe you've heard it before in this conference already, brain disorders are the leading cause for ill health and disability worldwide. And alone in Europe, there are 165 million people affected by brain disorders. It is also estimated that 1 in 3 people will be living with or suffering from a mental or a neurological condition in the course of their life. So you see how important research in this area is. And can I have my first slide that shows the topic of today? Okay, I need to click. No? Okay. Just go to the first one. Yeah. Okay, so indeed to the topic of today. No, back. No, that's the wrong way. Okay. Yes, stay on this slide. So harnessing AI for brain health. Harnessing AI for brain health. Why is this important? In fact, brain research and AI are strongly interrelated. And they are, if you could say so, in a mutually beneficial relationship with each other. On the one hand, brain research can help understand the working and functioning of the human brain, how it learns and how it adapts. And these insights can help to feed into the training of AI models. AI, in turn, has large data processing capabilities, which allows it to uncover patterns and gain new insights that would have otherwise been missed. So here we can see the synergies between the two, between research into the brain and AI, how they can be mutually beneficial, how they can both drive innovation in AI, and how they can advance the understanding of the human brain. So this is why it's crucial to have this session today and why projects like BRAINTEASER are really important in advancing health research and AI. So my name is Claudia Pretner, as I was already introduced. I'm product advisor at the Health and Digital Executive Agency. It's hard to remember my affiliation. We call it HDEA in short, so that's much easier. And I am also the project advisor of BRAINTEASER, which is the project that this workshop now is about. Okay, let's see if now it works to move the slides. Okay, yes. So first to our agency, HDEA. Who are we? I already told you, HDEA stands for the Health and Digital Executive Agency. What are our responsibilities as compared to the European Commission? While we at HDEA, we're strongly related to the Commission, we're not the same, we're a separate legal entity, and we have different roles. So the European Commission here is the one that defines the policies and also drafts the work program. The European Commission is divided in Directorates General, DGs in short. And then on the other hand, we have the executive agencies like HDEA is one. They are set up by the European Commission to implement calls for proposals and to manage EU-funded projects. So our agency, HDEA, it's one of the relatively newer ones. It was set up during the pandemic as a response actually to the pandemic to make Europe greener, more resilient to future challenges and more digital. And we implement programs and initiatives on behalf of the European Commission in the areas that you see here. So health, food, space, industry, and digital. Some of them are also related. Of course, there can be health and digital together, or food and health are also strongly related. Here you see our parents. We have 1, 2, 3, 4, 5, 6 parents. That's quite a lot, right? A lot to handle. I especially want to show you this slide to show you our beautiful building, the UFO, where we are located. And yes, we work closely with these DGs here that you see on the slide: Connect, RTD, Santé, and the others. Our vision, I've already said it, is to build from Earth to space a healthy society, digital economy, and competitive industry. What do we do more specifically? We manage programs related to the areas that you see on the slide, such as Horizon Europe, the health program. That's here the most important one for this session, probably. And that's also the program that this project has been funded under. There's other programs like the Single Market Program, Horizon Europe Digital, CEF, the Connected Europe Facility, and so on. We are in charge of a quite big budget, almost 20 billion euros over the course of 7 years, 2021 to 2027. And as you can see here, there's also a large chunk is dedicated to the health cluster, 5.8 billion euros. And now to health research, more specifically. Our aim is to find new ways to keep people healthy, to prevent diseases, develop better diagnostics and more effective therapies, to use personalized medicine approaches to improve healthcare and well-being, and to take up new and innovative technologies. Our areas of intervention are quite broad, ranging across everything you can see here: health throughout the life course, non-communicable and rare diseases, infectious diseases, environmental and social health determinants, tools and technologies, and healthcare systems more broadly. So we implement in my unit, we're a team of around 50 people. We implement the Horizon Europe Health Cluster and the Cancer Mission, which is a total budget of just under 6 billion euros. And we also implement the so-called legacy programs that are remaining from H2020, and that's 622 million. We have currently over 700 projects ongoing in our unit, as I said, divided among around 50 colleagues. We have an average grant size of around 8 million euros. And the range is from the smallest grants of like 1 million to even 200 million euros for the biggest projects. And we also have some open calls for proposals. Yes, still open right now. I'm just showing you this slide in case of interest. There's still 3 open calls, still a few more weeks that you can apply for. I'm also happy to share these slides afterwards if you want to have a closer look. So now, what is the future in brain research, brain health research, and what are we currently doing? So we currently have 132 ongoing projects in the area of health research. So that's out of the 723 that you saw in the other slide. And this represents a new contribution of 1.43 billion euros in funding. Quite a lot. What are the opportunities for brain research and innovation? Collaboration between multiple stakeholders, that's really key and very important to have these collaborations, not only between multiple stakeholders, also between multiple countries and institutes, to have access to infrastructures and resources, to capitalize on existing initiatives, to structure the brain research area, engaging patients and caregivers, and also to transforming results into technologies and products. Over the past decade, the EU funding in brain health issues has increased. However, despite the advances made, there are still many medical needs that have not been met. Therefore, research and innovation plays a key role to deliver improved and personalized treatments for patients, to devise more effective strategies for prevention and brain health promotion, and to provide evidence for better policymaking to counter brain health challenges. And in this light, there are also initiatives now to further strengthen collaboration. The European Commission is currently working on a European partnership for brain health. The expected start of this partnership is in January 2026, with a prospective duration of 7 years. Brain health in this context is to be understood very broadly, ranging from neural development, neuroplasticity, brain functioning, and mental health. The aim of the Brain Health Partnership is to accelerate the delivery of preventive, diagnostic, therapeutic, and care solutions to foster brain health in citizens and patients. Also to align efforts and funding from member states and associated countries in the brain health research area under one common strategic research and innovation agenda. And this strategic research and innovation and agenda has already been developed by a coordination and support action that's currently going on to pave the way for the future brain partnership. And they have already come up with this common strategic research and innovation agenda. Furthermore, an aim is to capitalize on existing initiatives and strengthen links with other key entities and to provide an impetus to brain research in Europe. So this future partnership is really about bringing all the research initiatives together under one single agenda. And if you want to learn more about this, I can point you to some colleagues here who can tell you more about this. So this already brings me kind of to the end of my presentation. I have a last slide here. If you want to become an expert for the European Commission, we're always looking for new experts in many kinds of areas. So feel free to apply here. You can see the link. We use these experts to assist us in evaluations and also in the review of projects. Now, actually, there's a question I wanted to ask at the beginning of my talk. Who here actually is working on the BrainTeaser project? Are there any representatives of BrainTeaser? Okay, quite a few. Wonderful, yes. So indeed, that leads me to my concluding remarks. Yes, BrainTeaser, you are almost at the end of your project now. So now it's really the time to start thinking also ahead, to think about exploitation and what comes next. How can you bring your solutions to the market? So this is a great opportunity now to discuss. And yes, I want to congratulate you on the work done so far, and good luck and a lot of success for the rest of your project. And I'm looking forward to listening now to the rest of the session. And thank you very much.
Okay, good afternoon again. I'm Barbara Di Camillo from the University of Padova in Italy, and I'm the scientific manager of the project. And well, in this, in this 10 minutes, what I will try to do is to present BRAINTEASER in brief, also showing some results of the project, and try to elicit a little bit of discussion that will follow, showing some results and some of the exploitation challenges that we are facing. Okay, really in brief, BRAINTEASER project is collecting data from app and portable sensor from the patients. It's collecting retrospective clinical data from the past, from the clinical centers that joined the project, and it's collecting data from air pollution, again from sensors that the patients can bring with them. And then the idea is to use all this data and to model them using artificial intelligence, among other statistical tools, to build models that can help simulating the disease progression, the treatment effect, forecasting what will happen to the patients, giving feedback to patients and to clinicians. So there are some main pillars of the project since the beginning. One is to involve clinicians and patients to design our solution, and this was done since the beginning. Then there is the idea to manage data in an open science view, promote fast feedback between patient and clinicians, and finally use AI to support healthcare. So let's start with the data. There are a lot of data in the project, so data are quite rich and are longitudinal, especially retrospective data, I must say, because when you talk about prospective data, the time frame of the project is quite limited, you know, to really monitor what happens to the patients, I mean, in terms of big numbers, of large numbers. But in total, we have data from more than 3,000 patients, which are collected in clinics, not in trials. So these are real world data. It's inclusive, let's say, by design, the choice of the patients. There are some challenges related to the data exploitation, which of course are related to data protection and privacy constraints, data quality and completeness, because again, those are real clinical data, interoperability, also language challenges, you know, because we have clinical centers from different regions, complexity of data governance, and also the ability when you exploit the data to ensure a continuity after the end of the project somehow. So what we did was first, since the beginning, in the informed consent that was signed by the patients, to inform the patient about the fact that the data would have been used to produce AI model, which in principle were possible objective of commercial exploitation, and also that no commercial exploitation of the data would have been conducted, even if the data would have been distributed in an anonymous way within scientific challenges, public scientific challenges. And we had 3 of these challenges in which all the scientific communities was invited to solve the same problems that we were trying to solve within the project. Then data verification, of course, so there was an accurate and laborious procedure of data cleaning and pre-processing, and also we built ontologies of the disease and harmonized the data sets also in terms of different languages. And then we published the data after the challenges on Zenodo. So there is an open access, but open access doesn't mean that the access is not controlled in any way. So who wants to access the data has to submit, let's say, a short project proposal that gets through an approval from a commission within the project partners. Then AI. More than 30 different models were produced during BRAINTEASER lifespan, considering stratification and prediction model, considering the 2 diseases we are focusing on, which are MS and ALS. We were predicting different outcomes also, And we were also analyzing the possible effect of pollution on the disease progression. And we are now including also sensor data. And there are main challenges which are related to the compliance with the AI Act, with the trust about AI, the usability, the practical usability in clinical setting, and the possible interest or not interest in the market. And what we did from the side of the project, let's say design and research, was to try to do everything keeping in mind responsible AI pillars. So we kept a human in command approach. So for example, the results of our model are given as feedback to the clinicians, but then it's always the clinicians that somehow is in the middle between the outcome of the algorithm and the communication to the patient. And then we focused really a lot on two aspects. One is explainability of the models, and the other is the ability of the models to generalize. So we sacrificed, let's say, a little bit the highest accuracy to be sure that we were able to generalize well on previously unseen data. So we wanted to know how good actually can be our models in future data in previously unseen patients. And now we are keeping track of model performance from one side, and we are also monitoring the effects of using our models with questionnaires and the feedback from clinicians and from the patients. Final aspect that I want to touch, the tools that we are developing, that we have developed actually, because now, as I told you, the patients are given sensors and a mobile app, but the mobile app is able also to give some feedback to the patients, and through these tools they are sending data which go through the models, and the clinicians can see the data and the prediction of the models. But even the data by themselves are a value because they can monitor in a sort of continuous way what happens to the patients, and the patients can send information to the clinicians. And then, of course, this value can go back, to the patient through the activity of the clinicians. There are a lot of challenges also here related to data accuracy and reliability, because we are using sensors that were not originally designed to be used in the clinical setting. Interoperability with clinical systems, the standardization of measurements also, and regulatory and compliance challenges related to the medical device certification. So what we are doing again is to try to personalize as much as possible the services accordingly to the disease type and also to the disease phase, and also monitor again the acceptance and utility of the apps for the patients from the patient's point of view. And finally, we started collecting data which might be useful to certify our tools as software as medical devices. So in the project, we didn't plan to arrive to a certification step, but at least to start collecting data toward this goal. And I thank you for your attention. And I hope this will elicit the discussion that will follow. Thank you.
Yeah, very good. So is there a slide just to present the session? Very good. So I would call our panelists. And so we have Elisabetta Baudano, Mats Sundgren. Of course, I'm pronouncing in a very bad way, so I will ask you to reintroduce yourself in a perfect way. Lisbeth Jerris, and I'm Gianmaria Silvello, professor from University of Padua. I'm also the coordinator of the Hereditary Project that I'm not going to present now, but if you have any question, I'm happy to answer or to present the project. It's pretty much related to what we have just discussed. Without further ado, I would proceed with the first question, and I would ask this to each one of you, and it's more about the relationship between the public and private partnership with the purpose of accelerating the translation from research and innovation. So how do you see this partnership, and what can we do to improve the transferring of results? We start with Matt. Thank you.
Should I start?
Oh, and you need this. And then
I think I'm audible anyway. So the role of private-public partnership programs, I mean, obviously there are vehicles for collaboration, which otherwise wouldn't take place. Private and public partnerships is not sort of easily, so that aspect is important. The other thing that comes up in my mind is, of course, providing the funding. There is no such thing as a free lunch, so funding is important. And of course, resources, infrastructures, and other things is important. And then there are challenges, but I think we are coming to that, right?
Yep. So, Elisabetta, please.
Yeah, hi, everybody. So just to introduce myself, I'm Elisabetta Vaudano from the Innovative Health Initiative, where I'm responsible of the strategic area neuroscience, among other things. So, of course, so partnership for us is bread and butter of every day, with the positive and the negative. But I think that indeed I would like to focus on two words. So of course, partnership means working together, and to put so people that normally will not be working simultaneously together. Okay. So it is not only the academia, the researcher that have the brilliant idea in the lab, and then the let's say the industry that will have to bring this in the market, but is also the end users. So in particular, so the people that have the different diseases, the doctors that have to cure them, and last but not least, not to forget, if one wants to get something to the market, has to go through a regulatory. So if you do a lot of work and you don't discuss with the regulator as early as possible, maybe you do a lot of work for them find out that you didn't get the right data that they need. So that's why it's important to create a partnership to really prime and get the research to innovation faster. And then the second word, let's say, is translation, because it means that everybody has to talk the same language. Everybody has to understand when we talk about something that is talking about the same thing. Seems trivial, it's not.
Thank you.
Thank you.
Lisbeth Jerris, please.
So my name is Lies. I'm from the University of Liège and Leuven here in Belgium, but I'm also the executive director of the VPH Institute, which is the International Society for In Silico Medicine. So I'm not a brain scientist, but my background is trying to get the ecosystem and the community together when it comes to creating virtual human twins. And we have been working on in an ecosystem manner on developing a roadmap for the virtual human twin for the past 2 years. And the very first thing we did was actually make sure that we had not just advisory boards from industry and regulatory, but that actually all of our meetings included all the different partners in order to get the translation. And maybe it's not, according to a very strict definition, a public-private partnership, but we have been, with the VPH and with the Avicenna Alliance, we have been working on a weekly basis on making sure that all the hurdles for in silico medicine are tackled in order to make sure that everybody who has a solution in the lab actually can bring it to the market and to the clinics. And one thing I would like to just give as an example that actually also relates to the regulatory part that you mentioned, we set out
to a couple of years ago to design something that was, or to create a white paper to stimulate organizations to think about good simulation practice, because we had been working a lot on regulatory science and on getting this to our community and to make sure that they understood what they had to do, but that it became a bit difficult to find out where to start in this whole endeavor. And after several meetings, people were anchoring to this, and we had industry, we had academia, but we also had FDA that became very much involved. We had HTA, so we had a huge amount of people that ultimately we had to publish it as a white book because it was so broad and so many people gave their perspective, and it was taken up. It was really quite a big success because people immediately grasped it as something that they could look at as to how this would work, not just for academia, but for industry, for regulators, and this contained the language that we could speak all together to make sure that we were making sure that we were taking all the steps that we needed to take in order to translate our work.
Well, thank you. We already started, I think, a bit of the discussion that we're going to have with the second question, which is how to overcome the barriers from research to the market. And we talked about regulations, and of course, that's a big barrier, or also something that can trigger the transfer. So, Matt.
Right, and I forgot to introduce myself, Matt Sundgren, and I work for European Institute for Innovation Through Health Data, or short IHD, which, by the way, is an outcome of a private-public partnership program in the first IMI program, and the project was electronic health records for clinical research. So I go straight into the challenges because there are a number of challenges. I mean, from personal experiences where we were 35 partners in that project, one of the things that we were going to pressure test R&D was a platform that in a safe way could reuse electronic health records data for different purposes, different use cases. How do you think it's possible to launch a commercial product that there is about 20 organizations who claim ownership? So it needs funding. It needs sort of, pressure testing is one thing. The other thing is to have a business model, how that would swing. So funding is an aspect. We introduced at the time, 2016, a business model for the project. Nowadays it's called sustainability aspect that is built in probably in every work packages. Easier said than done. Another thing that is important, I think, if doing innovation in this area is also the balance between rapid innovation and how long it takes to reach the patient as a praxis or so on. The other thing is, of course, bureaucracy. Bureaucracy has sort of two sideways. It is needed, but it could also be slowed down. Pragmatic solutions in moving forward in projects is important. The fourth aspect, I think, is also the data that is needed. We are all talking about projects, services that involves health data. So in that sense, it is quite important how to take the step. How do you take the step from pressure testing something that could be published, but how do you take it? How do you prepare the healthcare organization to actually implement it? And that is, I think, one of the challenges, how to do that in a way that sort of is not too fast and engaging them. But I will stop rambling and hand over to my colleague here.
Thank you.
Thank you very much. And then indeed, you were the precursor of so many stuff that come afterwards, huh? Indeed, indeed. And yes, so I think that I would like to pick up on one point that you mentioned, and to continue, very important is the readiness of the system. you can have do whatever wonderful things, but if the system is not ready there to pick it up, that will never happen or will not happen optimally. So that's why, again, important, how do you get the readiness to the system? You engage the system from the very beginning. And then, of course, then you will have to deal, of course, with the different regulation and things, but they are there. Actually, via the public-private partnership, there is also an opportunity to give feedback on what happened when you try to operationalize something, and then you can still say, hey, you've done this. This is, we can give some example, some evidence, robust evidence of really what is the consequence, but also how you should maybe use them, and then to give some guidelines, etc. So that's also what the partnership could be good for. And then again, technology, I mean, we are circumvented by technology, but indeed, it is all technology useful and used, which are the two things together. But again, I think really readiness, get the solution together with the patient. And also for AI, we need good data, because it's rubbish in, rubbish out. So that's my point.
Thank you.
Thank you. So to add to the last point that you made, or not the data, but before, finding the right problem to solve is also sometimes a challenge, because of course, there's need for blue sky research and technology push, but in a lot of cases, you need to pull from the end user in order to make sure that it ends well. The other element that I wanted to contribute, and now it just escapes me. No. Yes, the vision overall. I feel that if you, working on a roadmap for the virtual human twin for the coming decade, you find so much good work that is being done, but we're repeating so much work, and so much work gets lost. So in some areas, I would really like to have a bit more vision. We have a lot of research infrastructures, and everybody is creating edicts, and everybody is creating all these tools that have overlapping functionalities. And instead of, and I don't advocate for one big thing that can rule everything, but a bit more vision into how we can support certain things, and which things we should support, and how we can make things work together. I think that's sometimes needed, because I think also a lot of good work and ideas get lost in repeating some stuff that has already been done, but is just simply not well known because it was in a different application, or it was in a different kind of community, even though, you know, the technology is still the same.
Thank you. Thank you. This is very interesting. And I would like, before moving to the third question, just to dig a bit more on the readiness of the system and finding the right problem, because I was discussing with one of my colleagues that in the past we worked together in some technology. Now he's working for a company, and he told me, well, you know, we're putting in production something we worked on 10 years ago, right? And there is a lot of work that we need to do to transfer it to the market. So there is a big step from what we're doing in research and then moving to market that goes beyond regulatory aspects and the availability of data that are huge barriers or opportunities, of course. So I would ask, in your opinion, do we always need another project after a project where you find something that is useful to transfer your ideas to the market, so to operationalize what you did? How do you see this?
So to be absolutely candid, I think that we are repeating ourselves too much. It's exciting to run a research program, but I think it should be, as you are alluding to, we are ready now to pressure test. Let's make a commercial viable, something that can sustain and be incorporated to help patients. And as I said previously, the bureaucracy and the rules of many of these PPPs hasn't that in the gearbox. It should have. I think that EIT Health has such a scope in order to support projects. They support projects that has gone through the pressure testing, and they provide funding for solutions that has sort of taken the first act. So that's my personal opinion. What we did in the EHR4CL project where I was coordinator is that we secure funding from the pharma industry to actually sort of let one of the partners building a commercially professional sort of platform to launch it. If we hadn't done that, it has been buried in the archives, I would say.
Thank you. Yeah. If you want to jump in.
Well, I think that, again, I think we're talking about the readiness. I mean, clearly, we would like to, it would be great to have also more agile instrument, let's say, that we have now. So think about that. This would be great. We know that things are complicated. It's not simple to set up a partnership. It's not simple to run it. And but definitely, I mean, maybe we should also start to learn from other fields, like for example, physics, where there is much more sharing and then much like, shall we try to start citing data instead of citing only publication? I mean, this has been said, I don't know, many times. So, I mean, we are again going back to the same concept so that people get rewarded also for the data, not because they manage to get in nature, which can happen because of a pure chance or because you are in the fashion of the moment. And but also I think indeed what we see is that in our project where we have the patient there, I mean, when you say you finding the right question, if you have the patient there together, it is a very rewarding for the researcher and really guide you, because really when you have these people as part of your partnership in a very participatory research, then I think it's much easier than to really to decide and focus on the, let's say, the more important question.
Thank you. Lisbeth, if you have.
Yeah, very short to come back to the regulatory and the quality management aspects and the more agile system. It would be good that also those systems think along. There are other places in the world where also from the regulatory science perspective, there's more innovation that is pushed from the regulators, that they are thinking along. Whereas in Europe, the way we have created our institutions as either private or as very much underfunded agencies, that doesn't always help to get them on board of the innovation. Yeah, they will provide the lip service, but it isn't always easy for them because they simply don't have the means to take it one step further. So I think they're not just talking to them, but also helping them to drive to co-develop the innovation. I think that's also important.
Thank you, and thanks for saying that we need to cite data. It's something I worked for years and years. I couldn't have project funded about that, so you see, we should work also on that. Yeah. So thanks, and very interesting insights. And now it's my fault because I added one question, so we need to go very fast on the last one, which is, how do you think that technological innovation can really help patients with brain diseases?
So I can start. I think we are on the brink on a tremendous exciting journey, because I think there's different estimates, but let's say 80% of all the health data is unstructured. 20% is structured. Structured data is king, but there is the opportunity of using AI and natural language processing and integrative models and so on that could actually make sense of unstructured data. Companies like IOMED, that I also work for as a scientific advisor, has built up a platform of network hospitals in Spain and provided very interesting insights out of that unstructured data. So what I think this BRAINTEASER project is extremely interesting because it provides a completely new opportunity to help patients in a less reactive manner, more predictive, and actually being able them to take care, feedback mechanism back to them, monitoring, having information that is sort of captured with different cheap sensors and so on and so forth. Harnessing the unstructured data in a meaningful way provide, I think, tremendous opportunities for neurodegenerative disorders like we have been talking today. So, of course, there are, of course, challenges, but I think it is very, very interesting.
I can only echo, by the way, congratulations. Really, really nice results. And I hope also a little bit of what you learned participating in our project that's also helped shaping something. And but I would say indeed, again, I mean, if we think about how many of data there are out there and how many are actually exploited, what is it? I think I've also statistics something like 20% maybe maximum. So there is a lot out there that could be used. And indeed, I think this could really accelerate it, because we think that every time we have to start again with a new prospective study and then get the data and then get that how long will it take? 10 years. But with now with the AI, maybe also doing synthetic data and things, of course, that could really be extremely helpful for accelerating the field. Of course, things have to be done in the right way. And just quickly, since there is no time, I would like also to flag that we have some good resources on our website. For example, the way to engage with regulators, because we have a full guidance for people. It's for our project, but it's out there. So please have a look, because it's very useful for everybody. And also maybe you want to read also the report. We had a regulatory summit recently, and one of the areas that was discussed was AI and data.
Thank you. And Lisbeth?
I think this was a very complete answer, so I won't add anything to that.
Okay, thank you. Oh, yeah, of course.
So running a number of projects with private public partnerships and other kind of actors. Have you seen the movie A Beautiful Mind? So I'm talking about John Nash, and I think he got the Nobel Laureate Prize in Economics because on the Nash equilibrium. So what is Nash equilibrium? It has nothing to do with the disease. No, it's a principle that everyone work for themselves and the group at the same time. That's the best outcome. So running projects like these, C2 as a coordinator, that everyone gains.
This is a very, very nice insight, and thank you very much for this. I think they deserve a big applause. And thank you to Elisabetta Baudano, Mats Sundgren, and Lisbeth Gerris. And I think that we are perfectly on time, so I will not add anything, so that we are not going to be late. And we move to session 3, right? 2, 3, that now becomes session 2. So if you want to check your program, you have to skip to session 3, and then we have section 2. Thank you.
Thank you. So just a slight change of the programs. Now we'll move to session 3, where we will start with the demonstration by Carlos of the clinical lab, so one of the results of the BRAINTEASER project. And after that, we will start discussion about the also including in discussion not only BRAINTEASER representative, also representative of the AI Mind European funded project, to exchange opinion and let's say learn lessons so far on the use of innovative tools for the better management of healthcare for patients. Thank you.
Yeah. Yes. So my name is Carlos de Miguel. I'm a neurologist. I work in Madrid, in Hospital Gregorio Marañón, and I'm one of the clinicians who is participating in this project, collecting data from patients. And I was willing to do a live demonstration of the clinical tool, but it's not loading. Maybe we can put the slides on. So I'll start by introducing a clinical tool is just a web page that was designed for us clinicians to input the data of the patients. And we can also use this clinical tool to check on the patient's data that is collected with the devices we give the patients, and also to check the predictive models. Maybe we can put the slides on. I mean, sí, pero está toda en misa. Me voy a poner el profile. De todas formas, no funciona. I think we can put the slides. I mean, it should be okay.
Yeah, it's kind of connection. This is working.
I think that too many people are there, so let's be practical.
Okay, so I will. Maybe we can put the slides. I mean, it should be okay. Yes.
Now try again. We lost. I found those two.
Sure, it's okay. Hmm? Oh.
Your password?
No. Slides. I would go with the slides, I think. Huh?
Ah, sì. Social media.
Hmm? I think we can go with the slides, yeah, because otherwise it would take forever. Okay. Okay. So as I said, the webpage is this clinical tool that we use to input the patient's data, and also it collects the data from the devices and shows to us clinicians. So once you log in, that in theory you can log in from any computer. Most of the time, you're presented with this page, which is the main page. Okay, and here you can see all the patients that are enrolled on the study with their codes, and you can see some basic information to identify its patients. On the right side, you can see these symbols which indicate if the device the patient is having is updated and the information is being sent and registered in the database. So red indicates that something is wrong, maybe it's not updated, or maybe it's not receiving data, and green, it's okay, and yellow and orange is like we are not receiving data from the last 14 days. And so once you access one of the patients, you can see this page. The first tab is the patient overview, where you can see also some basic information about the patient and important symptoms like the symptom summary. I will explain this later, or the visits that the patients are pending. Here in the IA models, you can check the predictive models. In the case of the MS multiple sclerosis database is still work in progress, this part. Then here we have the follow-up on of our visits. We schedule a visit with the patient every 3 months. We register different data in each visit. Depending on the visit, we do some tests to the patients or other tests, and we also recollect clinical data about the disease. Here, for example, you can see a baseline visit where we we register the pharmacological treatment the patient is taking, the different instrumental evaluations that the patient has undergo, for example, the MRI in the case of MS, other important clinical data, and then some scales and tests that tell us information about the disability these patients have related to the disease, and also of the cognitive aspect of the patients of the disease. The next step is symptoms. In case of MS, the patient can report any symptoms that they may think it's important, or it may represent a relapse. And these symptoms, once the patient is reported in the app in their mobile phone, we can see it here, and we can call the patient. We can see this alert and ask about the symptoms to see if it's compatible with a relapse or not, and if something should be done related to this symptom. Here we can see all the questionnaires that the patient receives in his phone app that the patient usually answers from time to time, which is also information related with the disease. Some of the questionnaires are related with some symptoms or quality of life, etc. And lastly, we can see here the device data. Okay, in this tab, we can see that the exact device that the patient is using, and if the data is collecting correctly. And also we can see the last, well, we can change the timeline, but the data collected from these devices, in case of MS, we can see exactly specifically the daily steps that the patient is taking, the average sleep duration, and the average heart rate, which is all collected with the Garmin device. And lastly, in service configuration, we can select which activities or advices the app in the mobile phone shows to the patients, because it can be individualized depending on the different symptoms or disabilities the patient may have. And the last tab is the disease history, where you can see basic data about the disease, and also in the other tab, the patient profile, it shows personal information, so I cannot show it, but we can check also if any of the data collected at the beginning is wrong and change it. That's an overview of the clinical tool. So we are open for questions now, I think. Where is? Oh, yeah, sure.
So how many patients are on BRAINTEASER?
So at the moment, I think we have 302 enrolled patients. 200 of them are patients with MS, with multiple sclerosis, and 100, if I'm not mistaken, or 102, have ALS or amyotrophic lateral sclerosis.
And those are across 4 countries?
Yes, the centers are divided in Madrid, and in Padua, and in Lisbon, and Turin.
My last question is, have you been able to do some comparative the benefits of this technology, the benefits that patients report themselves and the physicians by means of treatment practices on this report, comparing with the standard way of following these patients? That would be extremely important. Are you doing that, or you are?
We are collecting data on that, but we want it to be better.
That would be a smashing paper, I would say.
Especially looking at the sensor data for at least for ALS, which is a fast disease. I think it's
yes, what we are basically improving now, because BRAINTEASER is a project that has lots of different substructures. So practically, as Barbara mentioned before, our first part of the project was related to the fact that we practically merged two very big ALS registry, the ALS from the Turin ALS Center, which is I think the most old ALS registry in Europe. We as Turin and the Irish registry for ALS. We build the model practically on this retrospective data, and with this model we can now give a prediction which has a high accuracy of 1.8. And what we are now try to understand if this kind of prediction can help clinicians to manage better and to plan and to stratify patients according to their disease, especially for ALS, because ALS, I don't know if most of you know, but it's a very heterogeneous disease. So we have a lot of different phenotypes. And one of the most important things for an ALS expert neurologist is to try to understand what is the trajectory of the disease in order to make a proper planning of care, an advanced care planning, in order to decide when what is the next visit, for example, for this patient, because we have to be very precise and very personalized with patient. And also we have to understand that we can have, and we are now measuring it, because we are trying to understand what are the perception of the patient. We make practically 3 different kind of questionnaires, one at the very beginning of the project, one in the middle part, and now we will finish in June, because this project was a pretty unfortunate one, because it started and then also the COVID started. So we have also this kind of misfortune. So so we were postponed in 6 months, but we are now making the final evaluation. The problem for the final evaluation is that we want to include a different patient, because in Italy, I try to mention every time this kind of conception, we cannot use the same patient to evaluate the tool, because in Italy we say ogni scarafone is bella mamma sua, which means that the same patient cannot evaluate what they contribute to make, because practically we design this kind of feature with patient. We feel all this. We are here also to show, for example, the patient app, because we are the patient app, and we can, for example, show that the app is full of content that we practically co-design with patient in some way. with the Portuguese Association of Patients. So, and we are evaluating what is the benefit.
My last question is, I would assume that you will be easy for you to collaborate with those who can devise the standard way of working with, so you don't have to do all the heavy lifting application. I would assume that they will be very interested, those who will sort of holding the industries and so on and so forth. Because this could be a very, very interesting paper.
I have a curiosity regarding MS, because we know also like that MS is very heterogeneous and we have different types. You have the aggressive, you have the progressive and so on. Did you consider associating brain imagery data to your model? And another thing regarding the, I don't know, because you have many countries involved, so the surveillance, the rhythm depends also on the phenotype. So how do you think would be the best options to homogenize the data, and also to maybe at the end to come up with propositions even for the clinicians on the therapeutic perspectives, and also to compare the different treatments that these patients are using in terms of efficiency? This model can help us a lot.
As you please. As you please.
Yes, so for imaging data, we are also collecting information in yearly, more or less, MRI is registered. The data is very grotesque, like it's not the proper image, but is important things like the load of tissue lesions, the average atrophy of the brain, if there are new lesions, if there are gadolinium-enhanced lesions, things like that. And also about extrapolating these results in order to choose a treatment. I think in case of MS, it would be very difficult because for any MS patients, you need a lot of variables to take into account, different prognostic factors and such. And even on the first time you see a patient with this data, you can choose a treatment, but many times not the best treatment for that patient, and you see that on the long term. So predictive models could help in that way to see maybe this patient will be okay with this kind of treatment, or maybe he needs another with more efficacy. But I think it's challenging to do this kind of prediction in the long term, especially because we need nowadays a very large span of time, because MS now is thanks to nowadays it's a very stable and treatable disease compared to before. So in order to see progression or relapses or events, you need a lot of time. It's one of the main problems we are facing in this project with MS, that we have very few events. In that case, we have very few relapses and very few progression changes in the patients. So in order to do something like that, we will need a very long-term study.
Thank you so much for the presentation, for the interesting project. I was wondering, we hear a lot about patient-related outcome, especially when we talk about clinical progression. So are you planning to integrate that? Because sometimes for the patients especially, they matter most than having like a specific number, I don't know, the MMSE or another number that is very important for us doctors, but it doesn't relate to patients. So
I think it's one of the plans that we are going to try to implement, because specifically in MS, I think in this project, PROs would be very interesting to see the results and match these results with the average activity. For example, if we see that a patient is underperforming in some of these PROs of quality of life, maybe it's interesting to see if at the same time he's doing less activity, or is in a more polluted area, something like that. So it's one of the things we have in mind also with this project.
In view of time, I would suggest to keep the next question for the dedicated Q&A sessions later. Now, I see, well, actually the discussion about the session 3 already started with Carlos and Umberto. Now I would like to join Vebjorn Anderson to the discussion. So he's not a representative of the BrainTeaser project, but the AI Mind project, let's say sister or parallel project within the EU-funded ecosystem. So I will kindly ask you to give a short introduction to yourself, to the project, and then also to provide, since we already received the information about the number of patients, number of countries for involving for BrainTeaser, also the same information for the AI Mind, and in particular, if you have already started to think how to face a larger deployment of a larger scale, so in more countries of the solution that you are developing.
So thank you. Yeah, so the AI Mind project is focusing on developing digitalized AI-based tools for dementia prediction in people with MCI or mild cognitive impairment. So this is a European project with 17 partners. So it's a lot of coordination with 4 of them clinical partners. In total, 1,000 patients are seen over a course of 2 years with 4 visits. So the state of the AI Mind project now is that we have soon to conclude the clinical phase of the AI Mind project, with the last patient visit now in January 2025. And the next phase now will be the data creation and the AI development modeling, training, validation, etc. And we have, from the beginning of the project, focused on how can we ensure that the outcome of the project can be exploited further on. So what we did in the AI Mind project is that from the beginning, we engaged a notifying body to be part of the consortium in order to give us advice on how we could standardize the processes, data creation, etc., in order to be able to, when we are at the end point, be able to take it up in further path to market processes. So that's kind of like how we are anticipating scaling it up. And of course, we need funding, so we are looking for more money always, but we will ensure that we have the right data and the right processes to be able to have a standardized protocol that can be delivered further on.
Thank you. And now we'd like to move to next question for all the 3 panelists. I will start with a comment from the previous panelist, Matt, about that AI is offering, and now we are, let's say, seeing and expect a tremendous, exciting journey. So I would like to know, from your experience, both in BrainTeaser and AI Mind, but also in your research and clinical activities, how do you see the evolution of the using of technologies as AI, but also telemonitoring? How you see the future perspective of using these innovative solutions from the clinical perspective, but also for the research perspective?
So I think it's a very exciting field to be involved, because it's going to develop a lot in the future. Because with this kind of technology, we can clinicians can get an image of the patient that is not like a photo of a moment. You can see like the patients during their daily life, no? And I think this is information that is crucial and is often lost in normal clinical appointments. With this kind of technology, and also, of course, with the help of AI, because otherwise it would be impossible to interpret all of this data, we could make more focused decisions on the patients, like changes on treatment. If we see it's not working properly, maybe we can, in case of MS, for example, detect progression that was not detected otherwise in normal clinical appointments. So I think in the future it would be more available for us to use, and it will help a lot of patients. It will be a complicated process, but I think we will get there.
Yeah, no, I totally agree. And I think you can also avoid this white coat syndrome, when you have patients visiting and the blood pressure rises and then you do the 24-hour and then you see it stabilizes. So I think that can be one of the solutions to kind of like avoid these false values that we can see also in what we are doing, cognitive testing also. That's one thing. And monitoring, of course, and monitoring effect of treatment, of therapy over time. And I think one other important aspect is to increase the accessibility. You don't need to travel to a clinic. You can have people from Norway, so it's a long country, so we can have people in the northern part of Norway doing this kind of clinical follow-up with monitoring, but based in the clinical research is based in Oslo, for example. So I think also it increases the accessibility for patients and participants to be part of these initiatives.
Yes, I completely agree. Regarding the telemedicine, I can speak about ALS. Telemonitoring has become for ALS probably a necessity even before the COVID pandemics, because I remember I was involved in a project 10 years ago, a former project which was a local one, but it was about the respiratory monitoring of ALS patient at home. But the problem of this project that when the financing finished, all get lost. It also changed the cost of this technology. Now we are in a very good moment because we are able to have a lot of data, also having low cost, because especially for some kind of monitoring, 10 years ago they were not so diffuse and so exploitable. So telemonitoring is very important. Regarding AI, I don't know if your question was also about the role of AI in clinics. I think that it has become really important, because it can help the clinician to make proper decision, because we know that humans make errors, AI make errors too, but probably AI supervised by humans can make less errors than AI alone and human alone, probably, because we are using external device, we use computer, we change completely the way we approach medical health in general. So I see a great opportunity to integrate AI. We have to remove the general idea that is now present regarding AI, that AI is simply a sort of game, a sort of tool that is not really validated. And so BrainTeaser is particularly this kind of project. We want to add a lot of information, research, because AI works good if a lot of human research has done before. So this is, I think, the most important thing that we have to focus.
Yeah, thank you all for your great answer and insights. Unfortunately, due of time, I will suggest to move to the next session. So I will invite for a round of applause of our expert. Also invite the audience to save their question from our final question and answer session at the end of the event. Thank you.
So let's have the semi-final session before arriving to the main key messages, let's say, from this discussion. Umberto is here with me already. It has been already introduced.
I don't forget to go away from the previous session, but I'm also on this session.
Elizabeth, please come with us. So we have also the voice of patients, which we are eager to listen right now. And I don't see Leon. Leon. So different when we are talking about technology. When we see each other on the video, it's very different when we see each other in person. Leon Brady, Business Development Manager for Garmin Health. So we can also hear from you a little bit the vision of the industry, which I think is very nice. We have been talking a lot about BrainTeaser technologies so far, and Umberto, as well as Carlos, has dedicated more than a word about what this technology mean in day-by-day practice for doctors, for sure. But we would like to also to understand what this technology can mean for a patient. So Elizabeth, if you would like to give us your view.
Thank you. Thank you for having us here, and I'm happy to represent the MS patients community today. For patients, the AI and the new technologies represent hope in a way that they are relying on this for a better quality of life in their daily life, first of all. So it's a way of tracking and ensuring that the data, information, and what happens to them is saved somewhere so that they can transfer that information to the healthcare professionals or the service providers in a way that is not mistaken. With MS, the cognitive issues is important. They are scared of discussing the symptoms they are facing, and sometimes it's just better to have something to track those information and then to transfer that. It also means a solution for physical constraints. So if they cannot go to their healthcare professionals, a way to reach them and to be to have access to easily to the service providers and to the healthcare professionals. But in another level, it's also the hope to be providing data that can help for better treatments, for improved quality of care, but also improved decision making when it comes to their disease in the not only with the healthcare professionals, but also with to have a more holistic approach. So to be able to share that information in a multidisciplinary team and to be able to not only consider the health issues, but also how they can have a better social inclusion. So it goes beyond health, and that brings some hope for the patient in that aspect.
Elizabeth, do you think that there is also a sort of a culture of data altruism? So having in mind that participating, for example, to an innovative approach to care and cure as the one that we going through with BRAINTEASER, we aim to, and patients have the conception that the data that they're sharing and the experience that they're sharing that can also support other patients and other people in that condition. So there is a culture within this altruism, let's say.
Yes, I think we have seen an evolution from where the patient had big trust issues with sharing data. It's still there, but I think now with more education towards the patient, it's improving, and the patients are willing to contribute their data because they are looking at the more impact that they can have, and they also maybe really it's specific to MS, but I've also seen that in many other disease areas. It's that they want to contribute to the community, to help the community. So it's that sense that really help for them to contribute to these projects, and they are very excited about any new developments.
Thank you. Umberto, would you like to add something from the clinician's point of view? I mean, you already mentioned something, but I don't know if you would like to complete.
I have just a very brief comment also relating to the BRAINTEASER project, which I'm involved. I must say that everything that has been said is true. We faced two different disease, ALS and MS. It was an enrichment of the project because we were able to cope with different kind of disease, different kind of patient. We confirmed that MS patient, probably because they are younger than ALS patient, get much more involved in the project. ALS patient received a very complex diagnosis, and what is, I think, is one of the most important troubles that we face in this project was also to foster the trust of patient to this new kind of technology, because if as a clinician, as human, we don't try to trust to doctors, to technologies. we became suspicious in some way, and we are not able to cope also with this new kind of technology and with this new kind of involvement in research, which is more patient-centered, but I must say human-centered than before.
So we are starting talking about obstacles, although yeah, you give me the ball in the right field. So we heard something about possible, obstacles in uptaking from the clinician's perspective, but what about the industry? I know there are a number of obstacles in real uptake of digital health solutions in around the world, I would say. Obviously, we are concentrating on Europe right now. For the industry, for the supply side, which are the main barriers in a full embracing of digital health solutions?
I guess the main obstacles, there's a couple that come to mind. One, of course, what we've been discussing, or what one of the sessions earlier has been discussing, is the translation from the scientific side now into a commercial solution, which is, of course, hugely complex because great researchers are not necessarily great at commercializing things, because that's not their area of expertise. So it's about finding the right partners in that process. We see that especially complex in Germany is one of the cases that was the first one to adopt a system where digital therapeutics can become are market ready. And there's still lots of difficulties about combining those two sides, the research side, the evidence-based side, and then also the commercial considerations. So that's at least what I think is one important part. Another bigger obstacle is also, especially once we look here at Europe, is a highly fragmented market and healthcare system. The Nordics in Europe have a completely different healthcare system and a completely different healthcare funding than we do in Central Europe or in Southern Europe, for example. So while it's great to see, this multi-centricity of projects like BrainTeaser, it's not the same translation that can be done for every single country. Again, taking the example of digital therapeutics with Germany and France being at the forefront, it's not as easy. Okay, I just need someone coming from Germany in France then to have a good market access. No, it's a completely different system. It's a completely different set of stakeholders that needs to be involved. Those are I guess the two main challenges that I see, and also not small challenges, not small obstacles.
No, huge challenges, I would say. Obviously, you're talking about reimbursement models, so PECAN in France and DIGA in Germany. Those two countries are the forefront for the digital therapeutics, but obviously we still miss a sort of homogenization in Europe, and a lot of developers and suppliers are really willing for a standardized set of rules and requirements as well. No, it would be easier than to overcome those barriers.
Yeah, of course. I mean, there's a long way to go. Nevertheless, I don't think those barriers should hold back from then, at this point with BrainTeaser, for example, or with other projects, attempting that translation from the scientific side into the commercial solution, especially if it's from the beginning designed with a patient centricity in mind.
Thank you. And then Elizabeth, centricity of patients in mind in developing solutions. This is something that really BrainTeaser embraced since the very beginning. So we did a lot of co-creation with all the final users, both clinicians and patients. How much co-creation and co-design, let's say, more practically, how much do you think this is important to enhance, let's say, acceptability of solutions by patients, and how this pathway can even be more stronger in the future?
So the co-designing with the patients is really important in the sense that we know at the end it will meet the needs of the patients, and having the patients along, understanding the concept, but also being able to provide the feedback a long way will help the integration of the patient in the system at a very early stage, and not imposing a system at the end of the project. So it's a nice way to already consider the patient as the main subject of the whole process. But main actor also. I think that's really important to consider and educate the patient at the very beginning, because they are the data provider. The patient will stop sharing their data or consenting for this, then we're losing the whole thing. So we have to be very mindful of to educate the patient in the right direction, to give them that trust, to build that with them, but also consider them as equal partner in the co-designing. And the other thing that we need to consider is how we can systemize that in a way in the future in the decision making, so that the involvement of the patient is becoming more institutionalized.
Thank you. Umberto, what about clinicians?
No, I completely agree with what Elizabeth said, especially because when I think of ALS patient, we sometimes propose some different kind of trials, and sometimes the patients say, I'm becoming an animal model. No, you're not becoming a model. You are becoming a researcher with us. You are a different kind of researcher in some way. And I think, especially regarding BRAINTEASER, the patient involvement is the solution to overcome obstacles, because we practice and we receive from the patient direct feedback for example, improve accessibility, improve usability of this kind of device. Also because when we think about a medical device for diabetes, for hypertension, we are just considering some, I probably it's not correct to call them simple disease, but with neurological disease, they affect cognition, they affect motor. So practically a lot of devices are designed for people with normal motor abilities or normal cognitive abilities. And co-design this kind of device with patient is very important, because we can learn how to make the correct features of this device in order to be much more useful for patient. The Garmin watch is a smartwatch for normal people, but in the BRAINTEASER project, we are transforming it in a tool that can be useful for patient with neurological condition.
Thank you. Leon, we were talking about the connection, I mean, how to translate research results in a business product, let's say, and we are talking here about two approaches, I think, that are very important. Then I don't want to say to guarantee a real business exploitation, but to enhance a sort of more facilitated pathway towards the market. And we are talking about co-design. So something that we develop that can be really useful for the end user, and that the end user would like to use at the same time. And we are also talking about digital literacy a little bit. And also, Elizabeth said we need to educate the patient, and I think that the same can be said for the clinicians. Those are very costly activities, and generally we were allowed to do those activities just because we had a funding coming from the European Commission. From the business perspective, I mean, from the industry side, how do you deal with these activities, and how much do you invest in these activities?
Yeah, I guess that's a big challenge, another big challenge, because the funding side, especially considering building something for such a fragmented healthcare market, is extremely, extremely costly. So it definitely needs the right partners. So I don't think, so considering Garmin as a collaborator or a partner in this project, I don't think one is even enough. And it certainly needs additional public funding to get through that process, because as with, for example, BRAINTEASER, the public interest is just so big, or is so much needed and so big enough that it needs and it requires public funding. Then once it's at a stage to go into a commercial solution, so it's ready to do that, not only in a clinical environment, but really in a say beyond a prototype stage, then we, as Garmin or as Garmin Health, we do contribute quite a bit to that commercialization, because we know if, for example, let's say Garmin smartwatches or generally wearables, because I mean, at some point you can't just have a closed system, are part of that solution. Of course, we have an interest for that solution to grow. That's true for healthcare solutions, or medical solutions, but that's also true for other areas that we're involved in. And at that stage, once we understand, okay, this helps not only the greater good and the public, which is good, but it also helps as Garmin, as a for-profit company, growing our business model, then we can invest in helping that grow. But I think it needs to be at a stage that is really close to the market, to market ready.
It's very solid already.
Yeah,
let's say. Okay.
Because in the end, I mean, there is just so many good solutions that, or even very good solutions that still fail to make it to the market. So there needs, we also need to allocate our resources accordingly to make sure we put them in the right place, and that, you know, not everything pays off, but at some point it develops into something successful.
Sure. Thank you so much. I'm very cautious about the timing. So really a last word of hope from each of you in this field. I mean, to maybe Elizabeth.
I think the focus should be on the outcomes and really to see how we can improve the quality of life of the people. And this is really moving in the right direction, but we shouldn't lose focus on keeping the patients involved at all stage. That would be my key thing. Keep educating the patients and keeping them on board so that they will be able to believe that their data is actually useful, and we can help the research and fasten the research for better access.
Leon.
I guess adding on to that, because I mean, we talked about the importance of patient involvement, is also, and then maybe looking to the future, making use of, let's say, data the patient already has or already brings. You did that in the BrainTeaser project with looking at historical data, and there's so much more to be leveraged, whether it's existing data from a wearable again, or from other sources. I think there is huge potential in enabling data sharing, because generally patients, participants are very open to doing something good with their data. So looking forward, I hope to see more of that, including also from our side, from Garmin side.
Sure. So secondary use of data, more or less, also. Yeah. Umberto.
I will be very, very brief. My hope is that BrainTeaser will not finish here and will continue in some way in another project or in some exploitable tools, because as a researcher, I'm a young researcher, but not so young, I must say. And I see so many very beautiful projects that just came to a scientific article, and we want not to improve our H index. We don't want to improve our academic skills, but we want to help people at all. This is our first objective. And pardon me for the emotion.
Thank you so much. Thank you to all my speakers. I forgot to introduce myself, although most of you know me. So I'm Natalia Allegretti, Senior Innovation Manager from ECH Alliance, and I am the communication and dissemination responsible for the BrainTeaser project. Everybody's hoping that BrainTeaser can really create a huge impact in the research field, primarily, obviously, for the patients, and also to help the industry, to grow a little bit more with this innovation and digital therapeutics, and we are here for this. So I leave the floor to Vincenzo sorry, madam. I was quick, because I'm always late, so I'm looking here saying, okay.
I'm Paola Zarati in Italian and Multiple Sclerosis Society. In general, I mean, regarding the digital device and digital approach, and coming back to the patient experience data story, So I know that there is now, data that is named PPI that is really assessing the patient preference for acceptability for a given device. So my question is, did you collect such a kind of data? And if yes, because also from regulatory point of view or approval point of view, is coming more and more important to really use this evidence to, approve, for example, a device for the market, so I wonder if you can comment on this, and if you know more about where we stand in terms of regulatory approval for this device, in terms of having, in addition to some requirement, also a clear data from patients that indicate that are acceptable for them, because this is going to be really a criteria also for set some level of assessment in, worldwide, the national or international level. So I wonder if you can comment on this, because I'm curious to know where we are.
Barbara, forse?
Yes, or
Umberto?
no, but it's because during the whole BrainTeaser journey, practically we collect the data. I just want to complete what Carlos said before, because one of the main problems with the ALS registry data was that they were built, for example, the Italian registry for MS was built in an era in which some kind of data that derives from MRI, that we know that now are the most important data to assess progression, were not available. So and also the population of MS was a little bit difficult to study. So we, in order to overcome this kind of limitation of the retrospective data, we introduced some patient-reported outcome PPI during the BrainTeaser project. So we monitor, for example, fatigue. We monitor some kinds of patient outcome through the project. And then, as you mentioned, the PPI, now we are collecting the last part of the questionnaire, but in order to avoid to use the same population that we use in the prospective part to develop the tool practically, but the MS patient that we involve in the first part already know all the journey that we make, and so they are not so, let me say, objective in evaluating the tool. So we are planning in the next 6 months to collect all the data in the survey. Probably what we are thinking on is to have a sort of open version of this app, and to involve also people from other anonymous MS patients that can evaluate directly and give us feedback in order to understand if this kind of technology can be much more usable in the world.
No, it would be very interesting. It would be very interesting. A case studies, important case study, to show
absolutely
what are the acceptability and what are the characteristics of the acceptability for tools like this.
Thank you.
Thank you.
It's okay. Thank you, Vincenzo. Thank you, panelists. Thank you so much.
Thank you.
Thank you, Natalia. Thank you to all the speakers so far. So for the last presentation of the event today, it will be just a quick introduction to the activities performed so far on the various aspects of potential exploitation, commercial exploitation of the results and tools developed within the BrainTeaser project. I'm Vincenzo Carbone. I lead the various activities of research and innovation funded project at In Silico Trials, and also I work as the innovation exploitation manager for the BrainTeaser project. So as a quick recap, as was shown before both by Barbara and also as explained by the various partners in the BrainTeaser project. So the goal of the BrainTeaser is to leverage data, big data coming not only for the health information, but also lifestyle habits and environment, pollution information to support patients with ALS and multiple sclerosis and their clinician. This was the initial description, but how you will see the involved stakeholders and the community of people involved in brain teaser evaluation have increased since the start of the project. So exploitation. So for the commercial exploitation, as Barbara already mentioned, there is not planned a commercial exploitation of the data collected from the patients. But what we could do, what we are starting to plan to think, and we are continuing to design to do, to connect the brain teaser results, the solutions, AI tools, to a broader reach. So patients, their families, clinicians, nurses, but also the ecosystem of industry, the developers of wearable system or the pharmaceutical companies. So how we can bring these results faster in an effective way to them. So exploitation activity is important, obviously, to bring the results to the market, also to the scientific community to continuously improve these solutions. And also it's important to guarantee a sustainability. So it was mentioned how the possibility to continue the activity of the research project of BrainTeaser also after the closing of the funding. But it's very important for the build of a trust from patients and their families into the AI models, AI solutions. So it's not something that is taking place of the clinician, but something to support clinicians and patients. And also to make this new approach to the healthcare and the support of model of healthcare to be accepted. And also we took into account all the various aspects of cybersecurity, data protection, for the clinician data coming from patient, but also take into account an open access approach with the possibility to share the data with the scientific community in order, again, to continuously improve the results. Yeah, so BrainTeaser project started in January 2021, so it will close at June in 2025 at, let's say, the half of the project activity. At the end of 2022, we prepare a preliminary exploitation plan. So we define, okay, which are the unique value proposition brought by BrainTeaser, the BrainTeaser results and tools. BrainTeaser solution can offer improved monitoring and stratification for ALS and MS patients, leveraging a continuous collection of data coming from sensor, from health monitoring, and to leverage this data and to train and improve artificial intelligence and machine learning solutions compared to what was the state of the art before the start of the project. We identified two main customer segments. The first one that was identified from the beginning were all the healthcare provider systems. So the clinicians to use the AI solution to receive a support into the making decision and also in their research medical activity. And in particular, these AI solutions, thanks to their explainability, information provided with them, would also support clinicians with less specific expertise on the specific disease, and obviously with no expertise required at all about computational information, artificial intelligence, and machine learning. But also we found out a great interest by pharmaceutical companies, not only to use or to propose this solution as like a digital companion when they offer drug treatments to patients, but also solutions to improve their activity during the development of new drugs. So, for example, the stratification of patients to improve the design of new clinical trials when involving new patients for the creation of new drugs. The main exploitation routes identified so far were obviously the possibility to identify further funding for the research activity. In particular, we have at the beginning of the event, the various calls provided and offered by the European Commission on this aspect. And another route is the so-called AI as a service. So the possibility to provide access to these solutions through a cloud-based approach. So in particular for the potential commercial customers to pay for the direct access and the use of such solution, again, without the required expertise on how to set up an AI model, how to set up a machine learning methodology, but just simplify use for them. And also it was mentioned before, it's really important we took into account also the possibility of the regulatory certification of the solution as a software, as a medical device. Obviously, a regulatory certification would increase the commercial appeal of such solutions to be, let's say, potentially integrated into a monitoring device or to be used by pharmaceutical companies in their activity. But also we started to think about that, the possibility to start collecting data for a future regulatory activity and request for certification. But the solution and the tools developed within BrainTeaser so far could also be initially distributed and offered for research and preclinical use in also to augment the number of successful use cases, and to collect extra data for the final regulatory approach. Very important, Natalia previously mentioned the terms co-design and co-creation. To define this exploitation roadmap from the beginning of the project, we organized a series of online workshops called focus group to collect feedback and to collect the requirements from the market, from the patients, from the clinicians, so that this could take into account for an improved design and development of the solution, but also for the development of the exploitation roadmap. So far, we have organized 4 online workshops. We started in 2022. We focused on the presentation of the first preliminary suitable exploitation routes, co-design, but then other online focus group focusing on the maximizing the use and value of the healthcare data collected in the project. And then we had the chance to present the AI solution for patient health professionals, and also how the AI solution developed in BrainTeaser will support the preventive medicine approach for early risk prediction. The final online focus group will be organized at the next year in around March 2025, where we will present what I indicated before, the approach of artificial intelligence as a service provided through cloud-based approach. So the possibility to offer these solutions without requiring scientific expertise, numerical expertise, also hardware, software requirements before, but a simplified and easier access to lower the barrier of adoption of innovative solutions. And with the closing of the BrainTeaser project at June 2025, we will also present the final exploitation plan. So this is an indication of the various institutions and companies which have been involved so far into the focus group. And also this is great to indicate how broad the BrainTeaser community was created. And so we collect feedback from a broad range of institutions. So obviously we started involving patients organization, clinicians, representative and nurses, but also we expanded that discussion to ethical experts, scientific experts, technological experts. We involved policy experts, also experts into the funding landscape, European funding landscape, experts in the regulatory aspect, as it was mentioned before, also creators of mobile monitoring, technological solutions, and also small and large biopharmaceutical companies which saw the great interest in these upcoming solutions. So very quickly, which were the main key takeaways that we collected during the focus group? Very important to inform and involve all stakeholders. So again, patients, their family, clinicians, nurses, the industrial ecosystem, ethical experts, and regulatory experts, in particular to inform and to increase the trust and motivate the patients to provide their data and support with their data the creation of better solutions for other patients. Also, as mentioned by Barbara before, explainability is key to support the clinician and patient, since we didn't want to provide AI solution as a black box where the clinician receive an outcome without knowing why and how to interpret these results. As mentioned, I also indicated by Leon, there is a strong interest by wearable manufacturers in the solution brought by the ecosystem of the users of these devices, since they are really interested in see the solution, also the different perspective brought by the research community into using this wearable device. And again, the strong interest by biopharmaceutical companies on how this solution could help to reduce improve the design of clinical trial, obviously reduce the fails in clinical trials for the development of new drugs, and also the aim, the possibility to refine, reduce, and also one day completely replace the need of placebo groups when involved during testing new drugs. Very important, data reliability, validity and compatibility obviously is very important, fundamental to satisfy the regulatory requirements when moving toward software as a medical device or a hardware that can be recognized as a medical device. But also it was important, was pointed to us that at the moment there is an uncertain phase since the recent release of the EU AI Act and how this can combine with the already existing GDPR or the medical device regulations. So we have to pay extra attention to the potential outcome of this combination in the future. This was really a quick, very high-level information about the ongoing activity for the exploitations. I thank you for all your attention. I think now we have still time for quick question and answer. Otherwise, I will invite Barbara for some closing remarks.
Yeah, I just have one short question. Thank you, and thank you for all the presentation about BrainTeaser. It's really interesting, and I see that there's also a lot of overlap and a lot of things that we in the AI Mind project can learn, because we are also doing the same in trying to develop diagnostic tools that can be put into the market. A question to you about how to coordinate the exploitation phase, because what we see in the AI Mind project is that we have a lot of partners that come into the project with different interests, and this is regulated in the consortium agreement of what kind of intellectual property you put in, but during the project a lot of new ideas and new constructs are built. How do you coordinate the IP interests of different partners, and also how do you communicate with the TTOs, the technology transfer offices of the, for example, the clinical partners? It's how do you ensure that everyone is on board and towards the same goal without ending up in a lot of debate or a lot of different interests pulling the project apart?
One of the activity that we perform in the BrainTeaser project is that we started with some periodic questionnaires and collection information from the different partners about the identify, let's say, a key value and key exploitable results collected. So, and in particular, the periodic tracking of this information to be certain about so the monitoring to ensure a complete understanding of the distinction between background IP and foreground IP. This is obviously a continuous activity. We are now in this phase of the project. We are starting a further collection of this information for continuous monitoring. It is, I can confirm, it is great importance. In particular, one of the activity that we try to do within BrainTeaser also to inform the patient about how the different strategy, about how the different aspects of protection of IP. For example, as innovation manager, we participated to a serious activity and services offered by European Commission, like the Horizon IP scan or Horizon results poster. This allows to get more familiar with the solutions and practice that can be shared with the patients about the better and clear understanding of how the management of IP or the management of potential commercial exploitation for the future.
Thank you.
Have to move here because otherwise I can't see anything. But I just want to thank you, all of you, for participating to this meeting, and yeah, have a nice evening then, and thank you again.